So hi everyone, welcome to our Medic School Nuts. Today we are going to discuss about our IMNCI guidelines of the pneumonia from the Indian guidelines, which is integrated the most important topic for the pediatrics as well as the PSM subjects. So in this FMG series, this is the short topic of the two because if you see the over the series of the different exams we have been seeing in the INISTATE, FMG, NEET PG, this topic is one of the most important. Even if you work in the peripheral centers as a medical officer also, the MNCA guidelines is the one of the most important guidelines. So let's start. This is about the completely about the pneumonia in the pediatric children, especially those who are children is vulnerable to the infections in the community acquired infections. The most common infection and due to the mortality also is very high in the children. So generally, what is the pneumonia when it is comes to the children? So usually the patients will be having the cough, cold, fever. This is the common symptoms. Along with that, we will be seeing the cyanosis because the patient is unable to breathe because the decreased the lungs is filled with the infection. It could be related to the abscess and it will be increased with the interstitial infection. And also sometimes if it is infected by the staphylococcus, the patient will be also having the nematocele. So the patients will be having the tachypnea, respiratory distress. Patient will be using the intercostal muscles, the grunting sound, and also the patient will be having the decreased feeding and even if you see some of the conditions, the patient, if he is suffering from the any other comorbidities also, the condition will be worsens more. So these are the some of the symptoms usually present in the children. Before we do any investigation, these are the symptoms we have to notice. So what will be the classification of the respiratory distress if we want to see? So the WHO has given the classification by the age group. For example, if the patient is between the birth to the infant period only, birth to 2 months, then the breathe more than 60 breaths per minute, it is considered as a respiratory distress. Immediately, we have to take the condition that this baby is suffering from the some of the condition. It could be pneumonia, it could be related to the RSV infection, anything. But the patient is in the severe respiratory distress. But after the 2 months, 2 months to 12 months, then it is the more than 50 or the equal to 50 breaths per minute. And if it is baby is more than 1 year, then it is until 5 years we have to consider more than 40 breaths per minute is considered to be the respiratory distress by the breaths per minute according to the WHO classification. Along with that, the baby will be having the tachypnea and cyanosis, nasal flaring, and chest palpitations. Like the baby will be having the severe respiratory distress all the intercostal muscles, subcostal, suprasternal, all the region, the tachypnea you will be seeing visible on the baby's body, and also sometimes the baby will be cessation of the breathing. This will be seen in the apnea, or the baby will be having the in the severe fever and decreased poor feeding, any other danger signs like seizures, vomitings. These conditions to be noticed immediately. And according to the IMNCI guidelines, not only these symptoms, but we have to see the baby general danger signs in all the babies, those who are coming to the peripheral health center. What are those danger signs? If you see, ask the mother, is the baby is able to drink properly or the breastfeed is the normal like the before, or the baby is decreased output and decreased input the baby is having. And ask the mother that is the baby is having the severe vomiting or the continuous vomiting, how many vomitings in a day, like that you have to investigate the baby is having any episode of the vomiting and decrease the feed. And next, the baby is does the baby is having the convulsions. Remember that the febrile convulsions is the most common in the pediatric age group. So that's why we have to check whether the baby is already have the seizure or the baby is having will be considered because the high temperature will lead to the febrile seizure. So we have to take the history from the mother. Does the baby have any convulsions? Because sometimes when the baby is having the chills and fever, sometimes the convulsion will be the subtle. So we don't even notice that the baby is having the convulsions. So we have to take note of the convulsions in the baby history also. And next, look the baby. Does the baby is looking the very lethargic, unconscious, and irritable? Any signs of the dehydration, severe dehydration signs also we have to take note. And one more thing you have to remember that the babies, those who are in the less than 5 years, that the babies will be having the malnutrition symptoms. It could be kwashiorkor or it could be marasmus. Take note that point also. Even the malnutrition is considered as a general danger sign. If you see any general danger sign, then you have to do the urgent attention and do the assessment and send to the high referral center immediately. And next, here comes the IMNCI guidelines of the different color codes. So first, does the really baby is having the pneumonia or not? So first thing is that usually the baby symptoms will be fever, cough, cold, and there will be no respiratory distress. As we discussed, according to the WHO classification, all the respiratory rate will be limited within the less than the limited classification, and there will be no signs of the respiratory distress or the cyanosis and any danger signs. So we can consider this patient as a no pneumonia. And then what you have to do is advise the mother that they soak the throat properly if the baby is having the severe cough, and then send the baby to the safe home remedy if the child is 6 months and older. And then tell the mother to, if you see any danger signs, immediately come to our health center and also follow up in the 5 days if not improving. There will be no intervention of the medicines in this green tag. And the next comes to the yellow tag. This patient will be having the fast breath. Either the baby will be having the more than 60 breaths per minute, those who are in the less than 2 months, and if the baby is more than 2 months, 50 breaths per minute, and if the baby is more than 1 year, then it is 40 breaths per minute. Clearly the baby will be having the fast breath. And next, along with the tachypnea, we will be seeing the chest in drawing. Chest in drawing is an optional thing. If it is a plus or minus, if you see the chest in drawing, it's still considered to be the pneumonia along with the tachypnea. And if you don't see also, still if it is a fast breathing is present, then you have to consider this as a pneumonia patient. And next, we will be giving the immediately amoxicillin oral 5 days course, and then follow up within the 2 days. It's not the 5 days. Within the 2 days, the mother has to brought the baby after the course of amoxicillin orally. If it still persists, then we are going to assess further any improvement or the worsens the condition in the baby. And the third tagline, this is the pink tagline, this is the severe pneumonia. Most of us will be making a mistake in the examinations while reading this question. Please see that in the severe pneumonia, along with the chest in drawing, fast breathing, the baby will be having the any danger sign, as we discussed, either convulsions, vomiting, unconsciousness, or the baby will be having any other malnutrition symptoms. Then the baby will be considered as a severe pneumonia. And chest in drawing, fast breathing will be already present. And if anything, it is chest in drawing is not present, general danger sign is not present. Still, the baby is having the stride out in the calm child, then it is considered to be the severe pneumonia. And tie that baby is a severe pneumonia and give immediately IV antibiotic. And if you are in the still in the peripheral center and you don't find any injectables immediately, then you can still give the oral amoxicillin and send immediately to the higher health center or the hospital immediately. So this is the guidelines that we need to follow. Either the baby is having the no pneumonia with only the flu-like symptoms, or the baby will be having the pneumonia symptoms with the fast breathing or the chest in drawing. And if the baby is having a severe pneumonia with the danger signs or chest in drawing, tachypnea stride out in the baby. So these are the conditions that we have to treat. No pneumonia, no medications. Pneumonia only we give the oral medication. Severe pneumonia, give the immediately IV antibiotic the first dose and send the baby to the higher center. So this is the one of the most important topic, guys. And somehow this will be repeating from the so long in all the exams, whether it could be the INICET, FMG, or the NEET PG. All these examinations will be repeating so long. You can integrate this topic with the pediatrics as well as the PSM. So please take note and please revise this one table at least before your day of examination. Here completes our short topic 2. And next week we are going to meet for the short topic 3. Until then, please do subscribe to our channel and share with your friends and colleagues. Thank you.